Many older men assume nighttime urination, weaker urine flow, or sudden urgency are simply normal parts of aging, and that belief is exactly why important warning signs are sometimes ignored for too long. This video is for health education only, and it does not diagnose, treat, or replace your doctor, but it can help you recognize patterns that deserve attention and timely medical evaluation. Most of the symptoms in this video can also happen in common non-cancer conditions, especially benign prostate enlargement or prostate inflammation. So the goal is not fear, but earlier awareness and better decisions. What matters most is not one symptom by itself, but whether symptoms keep coming back, gradually worsen, or appear together in a pattern that feels different from your normal baseline. By the end of this video, you will know which changes are often brushed off too easily, which signs should be discussed with a healthcare professional, and which ones should never be delayed. Before we begin, remember this simple rule that helps many older adults stay calm and practical. Do not panic, but do not ignore repeated changes that your body keeps sending. A single symptom does not prove prostate cancer, and many men have urinary symptoms for other reasons, but repeated changes still deserve attention because only proper evaluation can tell the difference. The prostate sits below the bladder and surrounds part of the urethra, so even small changes in this area can affect urination comfort and sexual function in subtle ways. Another helpful point to remember is this: many prostate cancers in early stages cause few or no obvious symptoms, which is why noticing persistent changes matters so much. As you listen, pay attention to what is new for you, what is increasing over time, and what feels unusual compared with your usual body patterns over the last several months. Now, let's begin with the most commonly overlooked group of symptoms, because these are the ones many men over 60 experience and often dismiss as harmless aging. 1. Frequent urination at night. Waking up often to urinate may seem harmless, but repeated nighttime trips can be your bladder asking for help. If you are waking up multiple times every night to urinate, especially when this becomes more frequent over time, that change should not automatically be written off as old age. The prostate surrounds the urethra, and when it enlarges or becomes abnormal, it can interfere with urine flow and make the bladder work harder to empty completely. That extra strain may cause sudden nighttime urges even when your bladder is not truly full, which can disrupt sleep and slowly drain your energy during the day. Many men blame late water intake, tea, coffee stress, or poor sleep habits, and those factors can matter, but recurring nighttime urination still deserves a closer look. If nighttime urination is happening more often, interrupting sleep regularly, or appearing with weak stream or urgency, it is a smart time to schedule a medical checkup. Let's move to the next sign, because many men who wake up often at night also notice that their urine stream no longer feels as strong as before. 2. Weak or slow urine flow. A weaker urine stream often changes so gradually that many men adapt to it without realizing something important is changing. A weak stream can feel like the urine is coming out with less force, less pressure, or a thinner stream than what used to feel normal for you. Sometimes the stream starts normally and then slows down suddenly, and other times it never feels strong from the beginning, which can make urination take longer than before. This may happen when the pathway for urine becomes narrowed or compressed, creating resistance that makes the bladder push harder just to do an ordinary job. Because there may be no pain, at first many men ignore this symptom for months and assume they are dehydrated, tired, or just getting older. A weak stream that repeats often, especially when paired with straining, interrupted flow, or the feeling of incomplete emptying, should be discussed with a healthcare professional soon. And that leads directly into the next sign, because weak flow often leaves urine behind and creates a frustrating feeling that the bladder never fully empties. 3. Feeling like the bladder does not empty completely. If you urinate and still feel pressure afterward, your body may be telling you the bladder is not clearing properly. Many men describe this symptom as a lingering pressure, a sensation that urine is still trapped, or the urge to return to the bathroom right away. When urine cannot pass freely because of obstruction or narrowing near the prostate, The bladder may empty only partially and keep sending signals that it is still full. At first, this may feel mild and easy to dismiss, especially if it happens only occasionally, but repeated incomplete emptying can create ongoing strain. Over time, that strain may affect comfort, increase irritation, and raise the risk of urinary problems because the bladder is repeatedly working under pressure. If you often feel unfinished after urinating, or you need to return to the bathroom within minutes, this is a reasonable and important reason to get checked. Now, here is another symptom that often appears in the same group, and many men feel embarrassed mentioning it even though it is extremely common. 4. Difficulty. Starting or stopping. Urination. Feeling the urge to urinate but needing to wait for the flow to begin is not something to casually ignore. Some men notice hesitation before urination starts, while others notice the flow stops and starts or takes effort to control when it ends. This can happen when the urethra is being narrowed or irritated, making the bladder work harder and making the act of urination feel less natural than before. Because the change often develops slowly, many people assume it is just stress, cold weather, or normal aging, and they wait too long before mentioning it. The key issue is pattern, because difficulty starting or stopping urination that repeats regularly usually means there is ongoing interference with normal urine flow. If hesitation, stop, and start urination or straining is becoming more frequent, especially with weak stream and nighttime urination, it is time for evaluation. Next is a symptom many people think is only caused by drinking too much fluid, but that is not always the full story. 5. Sudden urge to urinate. A strong urge to urinate that comes out of nowhere can be more than inconvenient when it keeps happening. This symptom often feels like your bladder is demanding immediate attention, even when you drank only a small amount and did not expect to need a bathroom quickly. Changes around the prostate can irritate nearby structures or alter bladder signaling, making the bladder feel overactive or overly sensitive to small amounts of urine. Many men blame caffeine anxiety, long car rides, or aging nerves, and those may contribute, but repeated urgency still deserves attention when it becomes a pattern. Early on, you may still make it to the bathroom in time, which is one reason this symptom is often minimized and brushed aside. If urgency happens, often interrupts sleep, causes rushing, or appears together with weak stream burning or incomplete emptying, it should be medically reviewed. Before we leave the urinary group, there is one more symptom that many people self-treat and ignore for too long. 6. Painful or burning urination. Burning during urination may come and go, but repeated discomfort is your body signaling irritation or inflammation. Painful urination can feel like burning, stinging, or sharp discomfort during the beginning, the end, or the entire time you urinate. This symptom may happen when tissues in the urinary pathway become irritated, inflamed, or compressed, and it should not be dismissed simply because it seems temporary. Many people assume it is a minor infection or irritation that will pass, and sometimes it does, but repeated burning still needs proper evaluation. A symptom that comes and goes is especially easy to ignore, yet repeated irritation can mean the underlying cause is still present and not fully resolved. If burning urination persists, returns often, or occurs with blood pelvic pain, fever, or urinary difficulty, you should seek medical care promptly. Now we are moving into the next section, and this is where the video becomes even more important because these signs are often harder to talk about. 7. Painful ejaculation. Many men stay silent about this symptom, but pain during ejaculation can be an important clue that should not be hidden. The prostate plays a major role in the ejaculation process, so changes in the prostate area can affect comfort during or after ejaculation. Some men feel a deep ache pressure or sharp pain in the pelvis lower abdomen or behind the pubic area during ejaculation or shortly afterward. Because this can be sensitive or embarrassing to discuss, many men wait too long and assume it is stress fatigue or something that will disappear on its own. A symptom that repeats during a normally painless body function is worth taking seriously, even if it is mild or happens only occasionally at first. If painful ejaculation happens more than once or begins to affect comfort and confidence, speak with a healthcare professional and do not keep guessing. The next symptom is also commonly blamed on age alone, but when it is new and persistent, it deserves more attention. 8. Erectile difficulties. Not every erection problem is just aging, and new persistent changes should be looked at with a wider health perspective. An erection depends on healthy nerves, blood flow hormones, and communication between the brain and pelvic structures all working together smoothly. The prostate sits close to nerves and blood vessels involved in sexual function, so problems in this area may contribute to changes in performance or response. Some men notice weaker erections, slower response, or difficulty maintaining firmness, even in situations that used to feel normal and comfortable before. Because stress sleep medications and circulation also affect erections, this symptom does not automatically point to one cause, which is why proper evaluation matters. If erectile difficulties are new, persistent, and happening along with urinary changes or pelvic discomfort, it is especially important to get checked. And now we come to one of the most important warning signs in this entire video, because even one episode should never be ignored. 9. Blood in the urine or semen. If you ever see blood in urine or semen even once, do not wait for it to happen again. Blood may appear as pink, red, brown, or rust-colored urine, or as streaks and discoloration in semen that look unusual or unfamiliar. The prostate and nearby urinary and reproductive structures contain many small blood vessels, and irritation or abnormal changes can sometimes cause bleeding. One reason this sign is dangerous to ignore is that it may appear briefly and then disappear, which falsely reassures many people. A symptom fading temporarily does not always mean the cause is gone, and that is why visible blood deserves prompt medical assessment every time. If you notice blood in urine or semen, especially with pain burning, weak flow, or pelvic pressure, contact a healthcare professional without delay. Next, we move into pain symptoms that many older adults mistake for arthritis posture problems or normal wear and tear. 10. Pelvic discomfort or deep pelvic pressure. Not all warning pain is sharp, and a dull, heavy feeling in the pelvis can be easy to overlook for months. Pelvic discomfort may feel like heaviness, fullness, deep aching, or pressure that lingers and does not clearly behave like a simple muscle strain. The pelvic area contains muscles, nerves, the bladder, the rectum, and reproductive structures, so abnormalities here may create vague but persistent discomfort. Many older adults blame prolonged sitting constipation, back strain, or digestion problems, which can be reasonable explanations, but repeated pain still matters. What makes pelvic discomfort more concerning is when it keeps returning, slowly worsens, or becomes more noticeable during sitting urination or bowel movements. If pelvic pressure or deep aching lasts for weeks, recurs often, or appears with urinary changes, do not just monitor it indefinitely. Now, here is another pain symptom that older adults often already have in some form, which makes new warning patterns harder to notice. 11. Lower back, hip, or upper thigh. Pain that does not follow a clear injury. When pain feels different from your usual arthritis or muscle soreness, that difference matters more than many people realize. Many adults over 60 live with occasional back or hip discomfort, which is exactly why new or unusual pain patterns can be hidden in plain sight. Pain that concerns doctors more often tends to persist, return repeatedly, worsen at night, or fail to improve as expected with rest and normal self-care. Some people describe it as deep aching in the lower back, hips, or upper thighs, especially when there is no clear lifting injury or fall. This symptom can have many causes, and most are not cancer, but persistent unexplained pain should not be dismissed when paired with urinary symptoms or weight loss. If back, hip, or upper thigh pain keeps returning, grows stronger, or affects walking and sleep, please arrange a medical evaluation soon. We are now entering the final group, and these next signs are whole body changes that many people either normalize or even celebrate by mistake. 12. unexplained weight loss or loss of appetite. Losing weight without trying may look like good news at first, but unplanned weight loss always deserves attention. Some older adults notice looser clothing, a slimmer face, or a smaller number on the scale without making major changes to diet or physical activity. Others first notice reduced appetite, early fullness, less interest in meals, or skipping snacks they used to enjoy without any clear reason. The important point is not just fat loss, because in older adults, unexplained weight loss may also include muscle loss, which can reduce strength and independence. Many people assume stress aging or a busy routine caused it, and those can play a role, but unexplained changes should still be discussed. If you are losing weight without trying eating less, without a clear cause, or feeling weaker while your clothes become looser, get checked. And now we come to the final sign, which is one of the most common and one of the easiest to dismiss. 13. Persistent fatigue or unusual weakness. If rest does not restore your energy the way it used to, your body may be signaling something deeper. Cancer-related fatigue is often described as a different kind of tiredness, where even small tasks feel unusually draining, and recovery feels slower than normal. You may notice that stairs feel harder, grocery bags feel heavier, or routine chores leave you tired in a way that does not match your effort. Because fatigue is common in older adults, it is often blamed on sleep stress, aging medications, or low activity, and sometimes that is true. But fatigue that persists for weeks worsens gradually, or appears with urinary changes. Pain or weight loss should be treated as an important health signal. If you feel unusually weak, less steady, or consistently exhausted despite rest, it is time to talk with a healthcare professional. Now, let's finish with the most useful part for many viewers, which is a simple checklist for when to seek evaluation sooner rather than later. You do not need to diagnose yourself, but you do need to know when symptoms should move from watching to checking. Please arrange a medical appointment soon if you see blood in your urine or semen, even if it appears only once and then disappears. Please seek evaluation if urinary symptoms such as nighttime urination, weak stream urgency burning, or incomplete emptying continue for several weeks or keep returning. Please do not delay if 2 or more symptoms are happening together, because combinations often reveal a clearer pattern than one symptom alone. Please get checked if pelvic pain, lower back pain, or hip pain persists without a clear injury, especially when it feels different from your usual aches. Please speak with a healthcare professional if weight loss, appetite loss, or fatigue appears without a clear reason and continues to progress. Remember, these signs do not automatically mean prostate cancer, because many prostate and urinary conditions can cause similar symptoms. But checking early gives clarity and peace of mind. The goal is not fear, but catching problems early while you still have more options and better outcomes. If you recognized 1 or more symptoms in this video, do not panic and do not try to diagnose yourself from the internet alone. Instead, use this information as a practical reminder to pay attention. Write down what you are noticing and schedule a medical checkup if symptoms persist. The earlier a problem is identified, the easier it often is to monitor, treat, or rule out, and that can protect both quality of life and peace of mind. Your body often speaks in small signals before a condition becomes serious, and learning to notice those signals is one of the smartest health habits after 60. If this video helped you, please share it with a father, husband, brother, uncle, or friend, because many men ignore symptoms until someone they trust speaks up. And if you want more clear, calm, and practical health information designed for older adults, subscribe to the channel and stay with us for the next video.